Right. Hi, everybody. Welcome to the June 9th edition of Senior Voices. And we will be presenting and listening to Susan Davidson, MSW of Westchester Senior Home Care, an aging life care professional. And she will be discussing I'm sorry, I do that every time. As your advocate in aging, she's going to discuss expert strategies for better care, better outcomes. So in starting this, I always like to welcome everybody. And actually, we do this for you, and always appreciate anyone who's coming out on such a gorgeous day. I mean, if we could hold it outside at the beach under a tent, we'd probably have the same amount of people, right? Because of bugs and everything. But no, we're here. And I always want to say thank you for choosing to spend your time with us. So I am Patty Yaffa. I'm one of the co-chairs of the Commission on Aging. And also here today, we have Chris Nolan, who is another co-chair on the Commission on Aging. We have Margie Mullen, who is a commissioner with the Commission on Aging. And Carmen, I'd like to introduce you as, well, you are Carmen Martin, but you are one of the gold ladies. So if anyone here does not yet have a gold card and you are a resident of Ridgefield, and I will not disclose the age requirement, please feel free to see Margie and sign up to get a gold card. It's free. We offer, or the merchants rather, offer discounts, and you'd be surprised at who is on that list because there is an abundant amount of all different entities. So let's see. All right. So I also and always want to thank Lucy Handley as our adult programmer. And without Lucy, we could not have this venue run so smoothly and have everybody just happy to be here. So in other news, I just always want to point out what we call our back table items. If you take a look later after the presentation, we have a flyer from Rides for Ridgefield regarding the transportation options for those who have mobility issues and don't have a car in general. And there is something about, speaking of food, we have something about food insecurity, as well as July 19th is Ice Cream Day and National Ice Cream Day. And you can, with your gold card, so even more of an incentive to get one, you can go to Deborah Ann's and you are entitled to one complimentary scoop. You can always add another and pay for that, but I always like to take advantage of that. So without further ado, I'd like to introduce Susan Davidson from Westchester Senior Care, and she's going to be very enlightening because when Margie and I first spoke with her, we kept saying, what? I didn't know that, and explain it more. So we're really pleased to have you here today. And thank you.
Well, welcome, everyone. I am delighted to be here, and I'm eager to share everything it is that I, as much as I can possibly share, but what it is that I do and what my profession does and how it's a role that many people don't even know exists. So the title of my talk is Aging on Your Own Terms, Planning Ahead, Living Well. You're clearly not alone, and I am and aging life care professionals are resources, and that's my intention today, is that you use me as a resource. And that's what my commitment is as an aging life care manager to all of my clients, is to be available as a resource. Now, let me see if I can get this to move forward.
You're so tall, you're far away from the mic. Is it possible?
Sure.
Closer to it. I know we've had this in the past.
Yeah, sure.
Even as you turn.
Yeah, but this is not advancing. Here, okay. No, it's advancing here, but not up here. Yeah. It's not, it's advancing on my, it's not advancing here. It's just not connected to the screen.
You try this. It's not working, I see. That's strange.
It was fine before.
Yeah, it worked before.
Did you from beginning again?
Yeah.
All right.
Did everyone get water or snacks if they wanted some?
There. Great. Okay, what did you, so just hit the down
I'll
button?
just hit the space bar, but you could do the clicker as well.
Okay, great. Okay. Great. Okay, perfect. So, you're in the right room. When you plan ahead, you have a better chance of life being on your own terms. I'm sure you have all lived long enough to know that. So, you're certainly not the first to wonder what comes next. This room is full of people asking the same questions. I am surrounded by people all the time asking me that question. I have that question. Today is learning about the options. So, most people have never heard of what it is that my profession does. We're called aging life care managers. We're also sometimes called geriatric care managers. We're trained to help you navigate aging with confidence, to help you live independent, full, active, meaningful lives for the rest of your life. We're experienced guides. We are intimately familiar with all the resources out there that many people aren't aware of, like a cold guard or rides for seniors or special programs offered at various senior centers, or there's just so many different programs out there that you've never had any reason to know about that we do know about and can educate people about. We're informed advocates. So, I advocate for my clients at doctor's appointments. I find that people, when they get sitting on the bench in a doctor's office or the table, they forget all the questions that they had. Sometimes their kids have questions and the kids want the questions answered. And the children will call me and say, look, could you make sure when you take my dad to the doctor today, could you please get information on the following things? So we're reliable reporters, and when fellow professionals like doctors or people in rehab facilities, social workers, all listen to us differently than they listen to family members. They shouldn't, but they do, because we're fellow professionals. It's talking professional to professional. So sometimes I can advocate for someone getting into a particular rehab that they just don't listen to the family because the family is just a family. That's wrong, but it's reality. And finally, we are steady long-term partners. So we're a member of the team. If you have a team of, doctors and maybe an aide at some point in time, we're a member of the team, sort of overlooking the your entire situation and shepherding you to the best possible solutions over the long term. So what I found is that the best way for me to really explain what it is that I do for people to get a sense of it is to talk about various clients. Obviously, I'm not going to reveal any client details. So I've made up names. Hi, welcome. Come in, grab a seat. I've made up names, I've disguised identities, but I'm talking about real people that I've worked with over the years to give you a sense of the breadth of what it is that aging life care managers do. So Mary, I'll be telling you about 4 different clients. Mary, I worked with her for 8 years from start to finish. Her son lived in the Midwest and he needed and wanted local eyes and ears. When he called in to check in with her, he was finding that she was just a little vaguer than usual. And he discovered that a couple of bills hadn't been paid. And she was just didn't seem to have the vibrancy. She was, when I met her, she was a delightful, vibrant, full of pizzazz, super social person whose life had gotten much narrower because she no longer could drive. And she wasn't happy about that. So I started really small with her and I just went over for a weekly visit and I quickly learned that she had several friends who were in similar circumstances who couldn't get out. So I said, well, let's have a luncheon. And so I picked her up one day and I picked up friend number 1 and then picked up friend number 2, took them all down to the local restaurant. They had a lovely luncheon, went to town. And when they were all done, I picked them all up, took them back home. And she, we did that a number of times. It was a way for her to kind of get out there. She didn't have any family living by. None of her friends were driving. It was a chance for her to really get out and be social. And as time went on, pretty quickly, I noticed that there was this growing pile of mail in the kitchen. So I said, well, want some help with the mail? And I helped her sort the mail. I pulled out the bills for her to pay. And she said, my arthritis is really bothering me. Can you just write the checks and I'll sign them? And so we did that for a while. I was communicating with the son because he was nervous about how his mom was doing. And he was so relieved that now that he knew the bills were being paid. So things were going along really nicely for Mary. We had these social engagements. Her life was getting sort of stable. And she took a fall, which, you all have friends who've taken falls. She ended up in the ER. We went to the ER together. And she had unfortunately broken her hip. And so, which is a story, all of you, if you hopefully haven't gone through it, but you know someone who has. And we got her into the rehab that she wanted to be in, really the best one for her. And after 4 weeks there, she said, I can't live alone. I don't want to lose my independence. I don't want to have someone in my space, but I'm scared to not have someone around to, if I fall again in the middle of the night. And so I found her a private aide, and that aide, Margaret, stayed with her for the next 6 years. And Margaret became like a member of the family. She was a daughter to her. And Margaret did a lot of the things that I did. Like she started going to some of the sort of less important doctor's appointments. But I stayed involved because there were always increasing needs. So after the Medicare provided PT, I found her a private physical therapist that could keep the services going. And then in time, she needed to have more medical oversight, and we didn't want her having to go to urgent care and wait for hours and hours in urgent care. So I worked closely with a nurse who came and provided sort of, RN care, nursing care, to check a wound, to see whether or not this flu was can be treated at home or she needed to go to the hospital. And over in time, we got her a hospice, and she stayed at home. We brought all the nursing home services to her, which is really what so many people want, and sometimes it's often doable to bring all the services to you in your home. So one of the things that people often ask me is, well, what's the difference between a private caregiver and a agency caregiver? I don't know if any of you have had any experience with caregiving, but an agency caregiver is someone who's employed by an agency, and you pay the agency, and they send whoever they want to you. And usually there's a minimum number of hours that they will work like 6 hours, 8 hours. 6 hours is a bare minimum, often like 8 or 10 hours. And you don't know who you're going to get, and you may get the same person week to week, day to day, or you may get often you get different people. A private caregiver is someone that you hire yourself. So you're paying them, you're interviewing them, you're hiring them, and they are yours. That you know who's going to come in week out. You're paying them an hourly rate that's far less than what you pay an agency, and they're getting paid more than what an agency pays them. So it's really a win-win for everyone. My experience with private caregivers is that frankly, they're angels. This is a calling that they have that I don't know if I could do it. Frankly, it's they really consider the private caregivers really consider their clients to be like theirs to take care of, and they are devoted and competent, trained. They're certified nursing assistants or home health aides, so the same training as people coming from an agency, but there's a entirely different mindset because the aides aren't being shuffled from one family to another. And so you're their person. So I'd be happy to explain more about the differences between private and agency caregivers, but I added that aspect to my business about I don't know, 6 years ago now, because I found that the quality of the care that people were getting from the agency caregivers was just not what I wanted for them. It was because the constantly changing people, they just weren't getting the kind of care that I wanted them to get. So the next person is Martha. She's a great example of when the spouse is overwhelmed. Martha's husband, Ralph, had Parkinson's, and he'd had it for 8 or 9 years. They had been managing fine, dealing with the Parkinson's for all those years, but she was now 87 years old, and she couldn't manage on her own anymore. But the problem was Ralph really liked his wife taking care of him. He didn't want to have some stranger in the house. So I met with both Ralph and with Martha, and I was able to convince Ralph that it would be a gift to his wife, who he'd been married to for 60 years, to allow her to hire an aide to come in for just a couple hours a day. And he was willing to do that once he began to see this is something he can do for his wife. She's been doing so much for me over these years. This is a gift I can give her to let Susan find an aide. And so we found someone for 2 to 3 hours a day, and that person got Ralph up, got him showered and breakfast and sort of settled for the day. And it gave Martha a chance to go for a walk, run to the grocery store by herself, go see a friend, and it just gave her just a little bit of a break. And that was the short-term solution for this family. And it was life got a whole lot better for both of them once Ralph was willing to accept the help that his wife could no longer provide. And they had contacted an agency, and the agency said, well, you've got to have someone for 8 hours. And they didn't need someone for 8 hours. They needed someone for just a couple hours. Okay, the next client is Tina, Tina and Kevin were in their early 90s, fiercely independent. Tina had early Alzheimer's, and Kevin was exhausted. He didn't understand how to deal with Alzheimer's. There were behaviors that he was seeing that were so unlike his wife. This was not the Tina that he knew and that he had married. And I mean, he loved her, he was devoted to her, but he just didn't know how to deal with the behaviors. Have you all had to deal with anyone with Alzheimer's? Can you share that experience? Yeah.
Very.
Yeah. Yeah. Yeah.
And I found that this is my father, we're not equipped, we're not skilled.
Right.
Taught even how to react and what something could mean, and what we should do and what we shouldn't do, which is all very critical thinking that we needed to know. We couldn't, we're not going.
Yeah.
We're trained.
Right. That's right. And there's no training for family members. But yeah.
Can't lift people.
Right. Yeah, like that, the prior person, she was 87 years old. She physically couldn't take care of her husband anymore. But then that happens with Alzheimer's, I mean, all the dementias. Yeah.
Difficult. My father-in-law had extraordinary bursts of anger. For
Right.
no reason.
Yeah.
Just done. And also, you could say something, have a conversation, and 5 minutes later, you'd have a clone of that conversation, as if he didn't hear you at all.
Yeah.
And I found that difficult, disconcerting, but
And how did your mother-in-law do with that?
she loved him very dearly and seemed to have accepted it as part of the course, I don't have the exact answer for you.
Yeah.
They were living in a graduated care center, and thank God they both were getting help.
Good.
But the anger was very difficult to deal with.
Yeah.
Out of nowhere.
Yeah. I mean, that happens. And really one of the tricks to do, one of the accommodations you can make with someone with Alzheimer's or any of the dementias is when they get angry is just to give them some space to walk away, because that whatever they're angry about, they're probably going to forget within a short period of time.
Nothing to do with me.
It's got not yet. You cannot take it personally. But it's hard because, you know, it's directed at you. It sure looks personal when it's coming at you, but it's not. It's the disease. And when people, you know, like I sometimes I'll talk with a family member. I said, you know, if your spouse had a limb amputated and they were limping, you would make accommodations. You wouldn't be angry with them. So Alzheimer's is a brain comparable, I mean, a brain malady comparable to losing a leg. It's just getting angry at them is not, it's the disease is the problem, but that's really, really hard to do. And so with Kevin, I spent a lot of time with Kevin, sort of coaching him in how to be with his wife and not lose his cool, and try to get things back to, you know, some level of stability. So, but in any event, so I met with them, and the first time I walked in, the son had called me. The first time I walked in, Tina took a look at me and she said, "What are you doing here? Leave." And I was like, I'm here to meet with Kevin. And she just wanted nothing to do with me. Like I was this intruder into their home. And she was perfectly fine, thank you, just the same, and go home. So she left. She went to the grocery store. So I met with Kevin and began the coaching, the dementia care coaching, but also he was physically suffering because she had lost the capacity to really prepare him a meal, and he was kind of like a 1950s husband and had never figured out how to cook. And so, no offense to 1950s husbands. And so he was hungry, and he was hungry, and he was losing weight, and he was losing strength. He was in his early 90s. I mean, he needed to be eating. And so after a couple of weeks we convinced Tina that I would come and work with Kevin on his paperwork. So that would get me into the house on a regular basis. I coached him all along about how to deal with very specific behaviors. And then after a short period of time, she was willing to take up my suggestion of hiring a chef service. And this chef service came in once a week and brought in like 4 or 5 dinners that were all in like takeaway containers with clear instructions about how to prepare the meal. And then he and she together would make the meal. He began to get nourishment. He started feeling a whole lot better because he was now getting fed. And she was willing to accept the care because she still had the thought that she was providing him with meals. So you have to really figure out in my role how to make the entry, how to find the way in. You know, sometimes it's through a side door. Sometimes it's often not straight head on. It's often roundabout. So I want to pause for a second and just talk about. I don't know if you all sort of understand the differences between dementia and Alzheimer's and Lewy body dementia and all. There's a lot of confusion out there. So I just want to take a minute and explain that. Dementia is like the broad umbrella term used to describe any cognitive neurological impairment, sort of like we talk about fruit. But then there's specific fruits, you know, oranges and apples and pineapples, and there are specific dementias. Like Alzheimer's is by far the most common one. There's different numbers, but 65–70% of any dementia is Alzheimer's. There's also Lewy body dementia. There's the dementia that Bruce Willis has, frontal temporal dementia. There's vascular dementia. Those are the 3 most common ones. There's a dementia associated with Parkinson's. There's a dementia associated with diabetes. So there are many, many different dementias, and they all have different very similar behaviors and also distinct behaviors. So neurologists can really guide you. And unfortunately, there's very little treatment for any of them, which to me is terrible. But it's useful to know which dementia you're dealing with, but frankly, not critical because, like I said, the way you treat it is often very similar. Okay, so the final person I want to talk about is Ted, who really illustrated the challenge of a very, very fragmented medical system. He was 87. He lived alone in the house where he had raised his family. His daughter was devoted, but she lived in the city and couldn't get away for all of his myriad doctor's appointments. So he, like everyone else, was really resistant to any help. You know, he was of the school that he could do it himself. And but he realized he was no longer able to drive. He realized that he needed someone to get to his doctor's appointments. So he called me his doctor partner, and we went to the neurologist, the urologist, the cardiologist, the ophthalmologist, the primary care physician, the dentist, I'm probably missing a couple. We went to it's like so many different doctor's appointments, and he enjoyed the ride because it was, you know, it was a pleasant ride over there, but he was just tired of all these appointments, and rightly so. And so I said, you know, we need to bring in a geriatrician. Now, a geriatrician is a MD whose specialty is geriatric care. So, and what they do is really coordinate all the other care that a person is receiving. So she began to have all these different doctors who had not been communicating with each other talk together. And instead of sending Ted to this, you know, neurologist sending them for this test, and the cardiologist saying you got to do this, and someone else saying you got to do that, we all sat down, the daughter, me, and Ted, with the geriatrician, spent an hour with her, because as a geriatrician, that's her motto, is she needs to spend time with patients. And through conversation, everyone got clear what it was that Ted wanted, which was stop the doctor's visits. I want to be comfortable, but I don't want the doctor's visits. And people can get on, daughters and sons can get on treadmills of, well, if the doctor says you got to go, then you got to go. And this doctor, you know, people will, you know, listen to the authority figure of a doctor and feel like they've got to do it. And if it's about their parent who they love, they're putting pressure on the parent to follow that advice. So this doctor made everyone stop and communicate. And so the daughter finally heard her dad and what her dad wanted, which was, I want to be comfortable, and I want to stay at home, and I don't want a million doctors. And so that's what we did. And once he was heard, he was now willing to receive help via an aide. So I found him an aide who was able to deal with his slightly cranky, slightly irascible manner. And she didn't take anything personally, let all of his crankiness sort of roll off her back. And they developed a lovely relationship. So his final months of life were about, you know, the way he wanted to live, at home with a aide who was fond of him, who he grew fond of, and only getting the medical care that was making him be more comfortable. And that all came from communication, you know, came from stepping outside of the medical system and listening and communicating among the family. Is there any questions at this point? Yes. Yes. Yeah. Well, I can't speak to Medicare Advantage, but they are, yes, a geriatrician is an MD and is covered. It's a specialty just like a cardiologist. And with if you have Medicare and a supplemental plan, you don't have to get a referral. depending on your Advantage plan, you may need a referral. Has anyone had any contact with a geriatrician? Do you
I
ever?
never heard of that.
Okay. Kind of like aging like care managers. There are not enough of them around here. But this particular one has a practice at a Phelps hospital, and she actually has a home. She will go to the home, come to your home, depending on where you live. And if it's too far for her, then she has a team that she sends out to assess you. So geriatricians, there should be way more of them. Northwell Optum had one, but she retired. They're really a godsend. Yeah. So let's see. So what I've heard over and over again is the following, and this, you may all relate to this. Susan, will you please help me maintain my independence? Now, how many of you have had that thought? Help me. So, yes. Yeah, tell me. Have you had to do battle with your children about that, or yeah. Uh-huh. He's saying that. He's saying that. Help me maintain my independence.
Absolutely.
Yeah.
He was diagnosed with a form of dementia
Uh-huh.
called executive orders,
Right.
and that's why I was late today,
Uh-huh.
and worse.
Yeah.
Very hard to live with.
Yeah. Because his executive functioning is probably just, he's not thinking clearly, right? Yeah. Yeah.
Dementia all the time.
And what do you do, if you don't mind my asking? What do you do when?
Well, Pete
Uh-huh.
said the question was not to start from the beginning where the problem evolved, because I know it, and he thinks I don't know it,
Uh-huh.
and I repeat it to him. And I would have to repeat the question 2 or 3 times,
Right.
and finally he will accept it. He will not take responsibility for his actions.
Right. Yeah.
And
That's
I am
impossible.
living in chaos.
Hmm.
Living in chaos.
Yeah. I'm sorry. That's hard. One of the things that often works with people in for you with your husband is when they become argumentative. I'm not talking about aggressive now. I'm talking about just argumentative, is to change the subject. If that's at all possible, divert them to something else. Yeah. Okay.
Then
Then come back. Yeah, it's hard. Yeah. Anyone else? Yeah.
Just on chronological age and people thinking that you're not not independent anymore.
Uh-huh.
I'm only 72, but people say to me, "You're old. Sit down. Don't do this.
Yeah.
We'll have someone else do this."
Yeah.
And it's
Yeah. Ageism is very real. I bet everyone here's got a story.
I'm 81, and when I get on the train, I would like to sit down, we can eat a place. Okay, but it's a feeling that people perceive me as being old and helpless, which I don't feel I am,
Yeah,
but that's the way you're perceived.
right. Yeah,
Say thank you. Yes.
right. There is actually a fine balance, which, yeah. Yeah, there's a fine balance, because sometimes when people want to help you, it's a gift to them to let them actually help you. You have probably experienced that, when you've wanted to help someone and they've said, no, 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 it's a little bit of a rebuff. But when they've said yes, you're pleased to be able to help them. So it's a balance between saying, thank you, I'd love that seat, or no, you know what, there's someone over here who looks like they could use it more, or I'm fine. I'm fully capable, but thanks for asking about me. So, but it's the ageism out in the world is rampant. We see it all the time. Yeah.
Sense to the human condition. No one wants to hear.
Yeah.
You know what I mean? Would
Right.
you like to sit down? Okay, sure.
Yeah. 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 That's right. Yeah. That's right. Yes. Did you have your hand up? No. Okay. Okay. So this is really like so much of what aging life care managers do is to try to help people maintain their independence. And independence can be differently defined. Like for that first client I told you about, Mary, having an aide live with her actually increased her independence. Having help can increase people's independence because now they've got the confidence to, not competence, but confidence to do things that they might not have been brave enough to do when they are living by themselves. And they've got probably wheels now to get places that they didn't have before. So having help really can increase independence. And so many of my clients say, no, 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 I don't want help. I don't need help. When it really does enhance their life. And it's a gift to the children as well. So, I hear, tell me what decisions I need to make today. So there's lots of things that people, should be decisions they should be making today. Do they have all their advanced directives in order? So by advanced directives, I mean a healthcare proxy. Everyone in this room, myself included, should have a healthcare proxy. Do you have a living will? So your healthcare proxy knows what you want if you're not able to make that decision. Have you had conversations with your healthcare proxy about what you want? You should have a power of attorney for the same reason, so that a bill can get paid if you're not able to do that. You should have your estate in order. These are all shoulds. I mean, and I really think that I don't like to broker in shoulds in life generally, but I really think this is on that list of shoulds. Is your will up to date? Have you done financial planning for your future? These are all things that will help you stay independent longer and have the quality of life that you want, and have, when you can't make a decision, have people doing things for you that are consistent with what you want. I hear this, help me avoid being a burden on my family. I hear that all the time. And I just would like you to think back to when you took care of your parents. What were the things that you heard from them that had you say back, no, you're not a burden, mom or dad? I mean, were your parents worried about being a burden, and were they a burden in the way that they asked? Anyone? I see you nodding.
I had a situation where I was caring for, I didn't know really
Uh-huh.
in Florida.
Oh, wow. And you were up here?
I was.
Wow.
It, taking your thought just a little bit farther, it's strange when they are not cognizant of who you are, what you are, how you're related,
Uh-huh.
and your intentions,
Right.
which gets very, very interesting.
Yeah.
To say the least.
Yeah. And why were you doing it?
Oh, I'm an only child, so descendant,
Yeah.
so.
So, yeah. Was it a burden, or did you, challenging? I'm not saying uh-huh.
I'm selfless person.
Yeah.
There, it wasn't like I had a choice.
Yeah. But I think people often think that they're a burden when it's actually, they're not a burden. They may be challenging to take care of, when you get older. It could be a challenge for one of your kids to figure out the best way to care for you. But burden is often people are worried about being a burden, and they're not a burden. Your children want to take care of you. They really want to take care of you. And I mean, taking care of an aunt who didn't know you is really going a step beyond. But, our kids, our families, we're not burdens. We're family, and we want to make it easy for them to provide care. Yeah.
I have a question. Your services, are they specific for each state so that we need to look at, you're in New York State?
Yeah.
And you're close by, is this something that is state specific?
No, not at all. Because it's a little bit regional. Some of it's regional specific. Like if someone from, Southern Jersey called me looking for help, I could help with coaching the family and helping them come, in that arena, just help coaching with dementia care or coaching with communication, but I'm not going to know the resources in Southern Jersey. So, but I certainly know, and all aging life care managers have to know the resources in their area. And one of the things that we all do is, I know a lot, but there's a lot I don't know. And when I don't know something, I'm good at getting answers. And I think any aging life care manager should say the same about themselves. That there's so many resources out there, and there's so many answers, so many options, that we need to be really good problem solvers and resource finders to be able to provide the services, because every client is presenting different situations. I had a client, she was one of my very first clients, and it was time for her, everyone agreed it was time for her to move into an assisted living. But she was an artist, and she had a basement filled with, I don't know, 100 paintings, and she just didn't want to get rid of them, and no one wanted her to get rid of them. So the family said to me, well, what do we do with all these paintings? It's what's keeping mom at home, and she needs to be not at home. And so I said, well, how about we have an art show? And so I'm not an art curator. I've never put on an art show, but we put on an art show. We called the local paper. They interviewed her. We put posters up around town. We had an art show, and she made $15,000 from selling her art. So it was, like I'm all the time, I'm presented with a situation that I've never done this before, but we're gonna figure it out. And that's why I love my job. Is that there's just so much creativity and problem solving. So help me avoid crisis-driven decisions. So that's, no one wants to be making a decision in the hospital hallway. You really want to, as much as possible, have made decisions beforehand. Now, there are always decisions that you have to make in the hospital, but you want to anticipate as much as possible. Have the doctors lined up that you like, know which hospitals you want to go to, and know what you or your loved one wants by way of care. How much care do they want? And then, so 5 qualities to look for when you're looking for an aging life care manager is, I think the most important one is, are they compassionate? Are they treating you and your family with warmth, dignity, and respect? That's critical, and like a unique person, which is the next point. That there's personalized planning. There's no cookie cutter approach. No 2 clients are alike. You and your aging life care manager build the plan together, and you build the plan with the older adult and the kid, if there's any children involved, and the doctors and the aging life care manager if you've got one involved. But you're working together as a team to build a unique plan for you. We are all in it with you for the long term. Is this someone who will, you can imagine, will grow with your needs? is, when you're looking for someone, does someone have the capacity to expand their services as and if your needs increase? Are they, I spoke about this, but are they a problem solver? Every situation has more options than you think. Finding them is what we do. And finally, all aging life care managers should be independent, meaning that they should not accept commissions or kickbacks or fees from any referral agency. That is against our code of ethics. Our loyalty is to you, and I never get and no aging life care manager should get any kind of fee for referring you. Because if I did, then I would just send you to the same person over and over again, whoever's going to pay me the most. I don't do that. I couldn't do that. So, I don't know what time it is.
It's 10:02, but I have another question. I
Yeah.
was just thinking, so when you say you keep following up, which is wonderful. How long do you what am I trying to say? So a client, have you taken care of one client in that family for months, days, years?
Years. Yeah,
It's-
like the
Okay,
longest,
years.
8-9 years is the longest I've taken care of a client. Yeah. And that client who had the art show, she was one of my first clients and she's still alive. So I'm still still somewhat involved. She's now moved out of my area, so I just keep in touch with the family just because I care, but I'm not involved in day-to-day stuff. Yes.
What do you speak to licensing and credentialing? What you-
Sure. Yeah. There's no there is no licensing required for an aging life care manager. To be a member of the Aging Life Care Association, you need to be either well, no, let me step back. There's a couple certifications that you can get, a critical care manager being one of them, and a case manager certification being another one of them, but they're not required. Anyone can hang their shingle out and be an aging life care manager. So, and they're not, unfortunately, pretty much not covered by Medicare, or 100% not covered by Medicare, but they are covered by some long-term care insurance policies. Now, some of the long-term care insurance policies have been written in that an aging life care manager who's a member of our organization their services are covered, and they should be, because it saves the long-term care insurance company money. Yeah. And people who are aging life care managers are often either social workers or nurses are two common, and also physical therapists will go into this field, will transition from that field to this field. Yeah.
I was a caretaker for my wife 5 years in hospice,
Wow.
and that's a whole different ballgame from what we're talking about here.
Yes.
But my concern is going forward, because my wife passed in September. What's available myself now that's left over. And you don't coordinate with the hospice people?
No, I do.
You,
Yeah. Yeah. I will refer people. I mean, I'll have the conversation with the family about, is it time for hospice? I can't make the referral because it has to come from an MD. But we'll have the conversation and then they'll decide to call their doctor and ask for the referral. But it's definitely something I'll get involved with. And then if the family wants additional care than what hospice provides, like Mary in the very beginning, the family wanted nursing care for the last few days of her life because they didn't know what they were doing, and they wanted to make sure that there was someone there with real medical training, which Margaret, the aide, didn't have. So Margaret was there sort of to hold her hand, so to speak, and the nurse was there to make sure she was getting the pain medications on time, and all of that. So, but yeah, I work with hospice all the time. Yeah.
Where do you find these wonderful aides?
Good question. That's a great question. So the aides that I work with have all come to me from either families or most likely other aides. So, for example, Margaret had an aunt whose patient died, and she called me. She said, "My aunt Peppy is looking for a job. Do you have anything available right now?" And so I then, interviewed Peppy and did all my, I do due diligence. I interview, I check references, I do criminal background checks, all that stuff. But they all have been like almost initially vetted by who's referring them, because the aides who refer them know that if they send me someone who's terrible, I'm, it's going to reflect badly on them. So, yeah, so they don't refer people who are terrible to me. So that's, I mean, so I get my aides from other aides. I don't advertise. I don't, they don't find me on Google. I've had one in all my years find me in Google. And I'd say I accept 1 out of 25 people. I would place 1 out of 25 people, aides that do get referred to me. I'm really particular. And I match, and hopefully anyone who does this does match. But, I have a client right now who has very advanced Alzheimer's, has really lost the capacity for speech, but she's physically well and she loves to be outdoors. And I found an aide who loves to be outdoors. And so they go for walks, like mile-long walks, a couple times a day in the good weather. And I've got other, so I have other aides where they're really great cooks, and the family just wants someone who can cook well. And some people who just need a companion. They don't need advanced, like certified nursing type of services. So I really am careful about matching. Sometimes, like Ted needed someone who could stand up to him and who wasn't going to be bullied because he could get pretty cranky at times. And other people who just need a very sweet, quiet aide. So everyone has different needs, and I do my best to match well. Yeah. Uh-huh. Yeah. Mhm.
Meds they can be studied, but what I learned during this whole really crash course, I had just moved from New York to be closer to my daughters. They knew we all need help.
Yeah.
And Medicare is very different where I lived in New York than it is here. So all of a sudden I had the elderly care worries because Medicare, if I got them into a nursing home, which by the way, many of them won't accept
Right.
about addiction.
Oh, right. Yeah. Yeah, because the psychiatric component. Yeah.
Moving, I mean, this would not be the most gentle, kind person.
Yeah.
So I learned that Connecticut, if you put him in a nursing home, first of all, you have to have at least 3 months worth of money to pay for it.
Mhm.
So it's not totally free. Luckily I did, but they'll take a lot of the spouse's money away to a certain point, but to a point where it'd be hard for the spouse to live. So here there is all this financial stuff happening. And I finally got him into a nursing home in New York, so maybe it'd be like he'd be the resident of New York and he'd get New York Medicare. It was crazy.
Yeah.
While I'm trying to deal with this man who wanted me to kill him, wanted me to take him to euthanasia, and they don't accept dementia people because you have to, if you want assisted death, you have to die. And
That's right.
So I just did what I could with angels, talk about it.
Yeah.
Doctors came in, he was burning off all the medication. He didn't want to live, and I got him into hospice care then by the end.
Yeah.
And they didn't know what they were doing. I knew it from my father. And I remember removing the oxygen from his nose because he shouldn't have had oxygen.
Yeah.
And he just smiled at me.
Hmm.
and he died on Christmas morning.
Oh, wow.
But I celebrated anyway, because he was just such a light. But what I'm saying is here you're going through not only trying to find care, who's gonna stay with a violent Alzheimer's person? They're not gonna take him to nursing homes.
Yeah,
It's smoking situation, but I mean, when you're like, noticing here, he's dying. And no one's fully telling you he's dying.
mhm.
You know what I have to say about dementia? I thought it was kind of a brain fog, but
Right.
it's really a brain disease.
Yes.
Your brain is destroyed. I'm telling you, when.
It's like, yeah, it is. It's a disease. Like we all know about the brain, cancer of the brain, but this is a different disease of the brain that
And you're-
no, there's not. I think you're talking about Medicaid versus Medicare. Yeah, because Medicare doesn't cover any nursing homes. But Medicaid does. And yeah, of course, but I just wanted for everyone else to just get that clear. And it's different state to state. Medicaid in New York is different than Medicaid in Connecticut or New Jersey. Well, yes, I mean, Medicaid is a whole different ball of wax. And when I have someone who is going to qualify for or wants to be on Medicaid, I refer them to a Medicaid specialist who I respect a lot because there's a lot of form filling out and big application process. And if you mess that up, things get really delayed. I don't want to, it's just not my specialty. It's just a area I didn't choose to specialize in. So I always refer to a Medicaid specialist. And there's Medicaid really can work really well. It even can work there are people who have Medicaid covered aides who I've placed privately, and they're community aides. They're called community aides. It's called the CDPAP program. And the Medicaid pays them like $20 an hour, and then they pay them $10 an hour. So they're getting, or $6 an hour. So they're getting a fair rate of pay as a private aid. But families at least getting $20 of it covered by someone else makes it much more affordable. Yeah.
You could clarify, you said cover nursing home, but it does for 90 days.
It covers rehab, and rehab can take place in a nursing home. But yeah, so if you spent 3 nights in a hospital and then you're sent to a rehab facility, which can be within a nursing home, they will cover 90 days. If you meet certain physical, like if you're making progress, if
Only in when the patient.
yeah, I mean, that's, and if yes. And I always go to my experts when there's a very specific question to make sure I'm giving the right information. Yeah. Any other questions on, this is my final slide. So I'm happy to provide a free consultation if you'd like. There's no obligation, there's no cost or anything. My goal is always to help you see the next step more clearly. There's my credentials, and thank you very much. You've been a wonderful audience. I really appreciate your questions. They've been thoughtful, and thank you for sharing so vulnerably.
I'm coming up behind you.
Okay.
And I share that sentiment. Thank you all for opening up and asking questions, because anything that may be personal to each of us could have some meaning to somebody else and resonate with another question. So before everyone leaves, Susan, you're going to stick around for a little bit if there's any other questions that you may not have thought of. And I also, in addition, yeah.
The brochure, so if you want to take the brochure.
That would be lovely. Okay, thank you. And I want to thank Lucy and the library staff who set up. We always are grateful for your partnership. And we could not do this without you. So speaking of not doing this without you, we will need you again. Our next Senior Voices is going to be July 14th, and we're going to go in a little different path. We are featuring Ryan Wenke, who is the CEO of the Prospector Theater. So we are going to have a talk about the Prospector Theater. And if you're like I was, or am, and Margie, we think we know about the Prospector and its origins and how amazingly wonderful it is, but you don't know everything. And it's an opportunity to learn it. And I just was fascinated. We almost couldn't let him go after we were speaking with him. And there is a promise of popcorn. That different varieties. So we're looking forward to that. And flyers will be coming out with that soon. And, go through your usual channels, keep your eyes and ears open. And again, Susan, thank you very, very much. We appreciate you. Okay.